Good evening. It's wonderful to be with all of you. I thank the Schwartz Center for this opportunity to speak about a topic that is so vital to healthcare. That topic, of course, is compassion. As I consider all the health professionals and caregivers who may be joining us this evening, along with their millions of colleagues around the world, we must remember that compassion is essential for these professionals as well. They need our support and understanding that will allow them, in turn, to become better caregivers for their patients. Patients who may be a close friend that we love, a parent, a child, and someday, most certainly, it will be me and you. This is why the work of the Schwartz Center is so important. It is the strongest possible voice and advocate for the people we often take for granted. The very same people who kept watch over us, who cared for us, who saved our lives during the COVID-19 pandemic, who often put our safety and care ahead of their own. Again, as we talk about compassion, these healthcare professionals went to unforeseen heights as they dealt with the worst health crisis of our lifetimes. These were days and nights filled with fear, suffering, despair. And yet, the sole mission was to provide some kind of healing, to offer some kind of human touch, some compassion to those who were suffering greatly and often about to die. I want to give a special thank you to this year's National Compassionate Caregivers of the Year and all caregivers for their extraordinary dedication to compassion during this global health crisis. Now, I wish I could describe all these tough times we've had as in the past tense. But today, in many parts of our country and around the world, COVID-19 remains extremely destructive. And this terrible pandemic is also exposing something we simply cannot ignore, that we have neglected public health for far too long. COVID-19 has laid bare the underlying inequities that are in our healthcare system and the consequence of underfunding and undervaluing public health. America must fundamentally reimagine what public health does and its place in our society. Because public health is not just about infection control. It's not just about COVID-19. It's not just about this pandemic. It is also about caring for the most vulnerable and helping to level the playing field of inequality. This matters so much to our presence and purpose here tonight because healthcare is a human right. You cannot have a compassionate healthcare system unless everyone has access to healthcare. And who are we as a people, as a society, as a community, to deny compassion, to deny care to anyone? Yes, we face many challenges now and in the days ahead. But I remain truly optimistic because, like you, I have seen the human spirit endure. I have watched dedication and resiliency take shape in so many different forms, in so many different ways. And when I think of all of us coming together tonight with a shared goal in mind, I know that together, anything and everything is possible.
Leana, thank you so much for being here and being part of this event for the Schwartz Center. It's great to welcome you back to Mass General and where you did some of your training. I think most people here in the audience already feel like they know you, given how much you've been on national television over the last year and a half, and you've certainly become a respected authority in public health. I was curious, what inspired your interest in public health?
Well, I appreciate the opportunity to speak with you, Dr. Slavin, Peter, if I may, and thank you so much for your leadership and service. Um, I guess for me in public health, what inspired me to enter this was my experience working in the emergency department. I actually had no concept of public health when I started my training in medicine. But of course, I also saw, as we all do in medicine, that so much of what determines the course of our patients' lives is not just about the health care that they receive. Of course, we aim to provide the best care possible when they come to the hospital. But at the same time, so much of what determines their health and well being is also about the air that they breathe, the food that they have access to, the educational opportunities that our children have. And so it's that holistic view of public health that I came to understand working in the emergency department. And that's very much what inspired my work in public health and drives me every day in that work.
As you know, the Schwartz Center, since its inception, has been uh, developing some really inspired programs aimed at trying to keep the compassion in healthcare. As you know, from somebody who trained in emergency medicine, people, and as you mentioned in your remarks, people in healthcare are very busy, and sometimes the path of least resistance is for the compassion to get squeezed out. Any thoughts about how best to go about keeping the compassion, the caring in the healthcare, which is so important both to providers as well as patients on the receiving end?
Yeah, it is really hard. And, when I was a second year medical student, my mother was misdiagnosed before she was finally diagnosed a year later with what turned out to be metastatic breast cancer. And so and then she went through many rounds of chemotherapy and radiation, surgery. She ended up dying when I was a second year resident. And so her illness coincided with my medical training. And I very much saw for myself this inadvertent disconnect that occurs between what it is that patients and family members need and what it is that health professionals are trying to do, that we as people in healthcare, we're trying to do the right thing. But as a result of the systems that we have in place that make it such that we're exacerbating this disconnect. And so I think being aware of this issue is a first step. Being aware that there are systemic challenges, but that there are things that we can each do today, including connecting with our patients, finding, as I mentioned in my remarks, something about our patients that we may not have thought about, not seeing them as a number or as a chief complaint, but understanding who it is that's in front of us. That leads to better diagnoses. That leads to the type of connection that I think is ultimately why we as providers went into medicine and what it is that our patients and families expect from us too.
And Lena, the last question I had for you is, I mean, healthcare is heavily dependent on bright, caring people entering the field. And I'm sure that this COVID experience has number one highlighted what heroes healthcare workers are and made it more attractive, but people have also seen a downside associated with it as well. What advice would you give a young person thinking about healthcare, or a young person who's recently entered the field of healthcare?
So many times there are these external factors in healthcare and in our systems and our policies that make it such that it feels like we're treating the medical record or we're focused on the computer in front of us rather than the patient, or we're bogged down because there are so many things. And this is one of the reasons I entered public health too. There's so much that we can't do for our patient within the four walls of the hospital. And I think that also leads to burnout because you feel like you can't do for your patient what you need to. But really emphasizing that patient in front of us and not losing sight of that level of compassion and understanding, that I think is ultimately what will keep us in the field and not just work in the field, but feel such gratitude to be able to come in and have the honor of treating our patients.
Lena, thank you so much for being part of this event, and thank you for the really important work that you're doing, trying to educate the American people about with facts and sage advice about this pandemic. So thank you for everything else you're doing as well.
Thank you very much, Peter, and thank you for your incredible leadership. I've learned from you, and so many of us have over the years. Thank you.